First, you're going to start by washing your hands. After washing our hands, we're going to put on our gloves and set up our tray. You'll grab a tray, take off your lid, put on a plastic tray cover, and then you'll put your paper over it. You'll grab your basic setup, and then 2 cotton tips, and lock your lid and carry it to your operatory. We now are going to set up our barriers. You're going to put your gloves on and start with your tape. We're going to put it on the knobs on the cabinets, just in case we might need to get in there during our procedure. You'll put a piece on each knob. Then you're going to take a piece and put it on your light switch. After that, you can grab a chair cover and put it on your chair. We are now grabbing light handle covers. Put them on your light handles and make sure they're secure. We are now going to grab a patient bib. You will now go to get your patient. Talk with your patient while you are putting on your PPE. Make sure to sanitize before putting on your mask and glasses. You will then sanitize again and put on your gloves. You will put on your patient's bib before beginning the exam. Before starting the procedure, you will take the lid off your tray and open your instruments. You're going to lean your patient back to begin the exam. You now are going to bring the light to the patient. Make sure to start it on their chest so it doesn't go in their eyes. Then you're going to call your landmarks. Make sure you turn off your light before setting up the patient and push it away. We are now going to dismiss our patient. Take the bib off, throw it away with your gloves, and sanitize. We then will take off our glasses and mask and sanitize again. We are now going to walk our patient out and dismiss them. We now are going to begin breaking down the room. Start by putting on your mask, glasses, and utility gloves. Start by putting your lid on your tray and taking it to sterilization. You will kick the button on the ground, the door will open, and you'll put it in there. Make sure to close it before you leave. Go back to your room, take down your barriers, and throw them away. You will now begin your spray, wipe, spray, wipe. Make sure not to soak the chair, just one good spray. You'll grab 2 wipes and begin wiping down the assisting chair, the lead chair, the counter, the tray holder, the light, and the patient chair. Make sure you do this twice. We are now going to head to sterilization. Open the door by kicking the button. Open your tray. You're going to take your instruments, pull instruments out, and wash them off. Put your instruments in a band, place them in, and turn it on. Wash your instruments off and place them on the paper towel. You're now going to throw your trash away. Now you will grab a bag and put your instruments in it. Make sure to label the bag with M11, your initials, and the date. You will then place them in the autoclave, paper down, hit pouches, and start. Before doing so, make sure the water level is in the green. You're now going to spray your tray and wipe it down with a cappy wipe. Make sure to carry it over to the clean area, holding the tray with the wipe. You're then going to do the same with the lid. Carry it over with the wipe. After you are finished, you are now going to wash your hands. wipe your utility gloves down with a Cavi wipe. Take them off and place them in your box. You are now going to wash or sanitize your hands before taking your PPE off. You are now going to take your glasses off, then your mask and your jacket, and sanitize or wash after you are finished.